Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, physician burnout, how can the public help? But first, finally, new congressional maps. What does that all mean? Back in a moment.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, it seemed like the day would never come, but we finally got congressional maps. To chat about that, we have Marc Levy with the Associated Press and Angela Couloumbis with Spotlight PA. All right, Marc and Angela, both of you have been covering this. Marc, I want to tell you, it seemed like this went on and on and on and on forever. Give us a brief history before we get to the significance and the change.
So yeah, Pennsylvania is one of the last states in the nation to settle its congressional map for the next decade. The census results were late, so that made this late, and then there was partisan deadlock in the state capitol between the Republican-controlled legislature and the governor, Tom Wolf, who's a Democrat. They couldn't agree on a map, and finally the courts got involved in late January and took it over, and this is what happens when the governor and the legislature can't agree on a congressional map. It happened 3 decades ago like this. It went to the court picked a map, and
right.
That's what we see.
And in 2018, it happened also where they couldn't come into an agreement, correct?
Well, that was after a lawsuit against the 2012 map, and the court agreed with the challengers that it was an unconstitutional partisan gerrymander by Republicans. It threw out the map. It gave them 2 or 3 weeks, the lawmakers and the governor, to agree on the new map, and they couldn't, and so it drew its own.
Yeah. Now, what are the big? Now, here's the argument that I've heard, that basically the map doesn't bring about enormous change. Right. We go from 18 lawmakers, we have 9 Rs, 9 Ds. Right. We go to 17. Right. And it doesn't look like, I mean, I looked at it and others have commented on it, that there's a big change, or am I wrong about that?
Yeah, it seems that the map that the court selected hews very closely to what's in place right now, meaning that there are going to be competitive districts, and there are 3 in particular that have been pointed out as remaining particularly competitive. There are some analyses that actually give Democrats maybe a 1-district advantage. Others give Republicans a 1-district advantage. However, Republicans were very upset at the map that was chosen by the court. They feel that they had a better plan. They had also submitted a map.
But the map the court picked was the map basically submitted by Democrats. So voters. That automatically probably put the Republicans on edge, correct?
Absolutely. It was submitted by voters, Democratic voters. But yes, I mean, it was another thing that they pointed to as potentially being a political move by the court. They have had they've tussled with the fact that the Supreme Court here in Pennsylvania is now dominated by Democrats, and they've taken aim at that, not just for this, but for other issues involving election-related matters.
Right. In all fairness, the Commonwealth Court, which deals with these subjects as well, is Republican, correct?
That's right, and had actually, before this, had sided with, had accepted the Republican-drawn map.
Yeah. All right, where does all this go? I mean, now it looks like the schedule's been amended somewhat for the filing of the petitions, but there are state lawmakers are not included. That seems overly complicated to me. Take it.
Right. So state legislative maps have to get redrawn too, because the census just came out. You have to adjust for a decade of demographic changes. The state legislative maps are done, but they're still under court challenge. So we won't really have a final court decision until early March. So candidates for Congress and statewide races like governor, U.S. Senate, and lieutenant governor can start circulating their petitions on Friday to get on the ballot. But that period has been suspended for legislative candidates. The court kept the May 17 primary intact for congressional candidates and statewide candidates, but they have suspended it for people running for the state legislature.
See, so you're telling me we're going to have 2 elections?
It's out there. It's possible.
Now, what will the turn? I mean, now we're speculating wildly, but it seems to me if we have 2 elections, particularly when we get down to the state legislature, we're not going to have a huge turnout. I mean, if you had it in the context of governor and Senate and Congress, that's one thing. This doesn't make. it's really complicated.
I will say this, that when it came down to it in 1992, the court created a 7-week period between petitions and the primary for congressional candidates, so it could still do that for legislative candidates and keep the primary on time on May 17th.
And it's still a good way off yet. Remember, we're talking about May 17th, so we've got to get through March, April, and half of May, correct?
You could still do a 3-week petition gathering period in March for legislative candidates, and then have 6 or 7 weeks of primary election time after that.
All right, well, we'll move on to another topic. I'll tell you, mail-in voting, it is also complicated. It involves the law, and we'll see where all that goes after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
All right, we have another important subject to talk about, and that is mail-in voting. I'll tell you, Angela Couloumbis, it seems like we have these two huge issues that matter a lot. Mail-in voting is a big issue. It's complicated. It's also very partisan.
Yeah, and I should say that it's also very popular with voters, particularly since it went into effect right as the pandemic hit. So just a little bit of background, it was a law that was passed with bipartisan support in 2019. People hailed it in the Capitol as one of the most significant election changes in decades. And effectively what it did is it allowed people to vote by mail without needing an excuse. For instance, I'm out of my district or out of the state. And what we saw was in 2020, when it first went into effect, there were so many people who were signing up to vote by mail. It kind of coincided with the pandemic, so it became a choice for voters and a popular choice. Fast forward to last year, there was a lawsuit by Republicans challenging the way Act 77, which was the law that brought in no excuse mail voting, was passed. It went to Commonwealth Court. The court actually agreed with Republicans, and for a split second there, everybody thought, oh my goodness, mail ballots are off the table, but it was immediately appealed to the Supreme Court.
Which you would have expected, right?
Absolutely, and now the Supreme Court is going to weigh in. There are arguments scheduled for next month.
Well, Mark, the fact of the matter is that more Democrats use it than Republican, which is probably the major reason why this has become partisan.
Well, there was no problem with mail-in voting until around March of 2020, when Donald Trump on the campaign trail began demonizing it as rife with fraud, which is completely baseless. There's just no evidence that mail-in voting is somehow rife with widespread fraud. But what you saw is in the primary that year, Democrats used mail-in voting heavily in the teeth of the pandemic, and Republicans did not. And that didn't change in the general either, that Democrats by more than 2-1 outvoted Republicans in mail-in voting. And after the election, you saw Republicans continue to dislike mail-in voting, and that resulted in 2 lawsuits against it, including one by Republican lawmakers who voted for it.
Right. So this is before the Supreme Court now?
Right.
So where does it?
So I've talked to a couple of legal experts, and they actually say that, both sides have sound arguments. They do think, given the way the court has ruled, the High Court has ruled in previous cases involving voter access, that it will uphold the constitutionality of mail ballots. But there are, not to get too complicated, a couple of warring sections of the Constitution that each side is citing as evidence that the way it went into effect was sound. Republicans say that it was unconstitutional, and that their argument is that the way it should have passed was not through a traditional bill, but through a constitutional amendment, which, as you know, is a very lengthy process.
Yes. So there's a good chance that both of these measures that we're talking about end up in the federal courts, correct? Now, the federal courts have been reluctant to get involved in state issues, if I understand this correctly.
Yeah, and so there is a federal court challenge involving the congressional map. I think the constitutional lawyers watching this fully expect it to be dismissed, because this is how states deal with congressional maps when the governor and the legislature can't agree.
And that's how the 2018 map was dismissed, correct?
Yeah, the U.S. Supreme Court would not hear a challenge to it. But also in 1992, the state courts picked the map. And this is what happens in states. And so there is a backstop in the U.S. Constitution about what happens when the state can't write its congressional map. But the courts are considered part of the process. The state courts are considered part of that.
Well, I want to thank you. I tell you can't make this up and how complicated it is, and I want to thank you for helping us understand it. All right, Physician Burnout, how can the public help? Back after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Physician Burnout, how can the public help? Joining me is Dr. David Talenti, MD. He's the president of the Pennsylvania Medical Society. Doctor, welcome to the program.
Thank you, Terry. Good to be with you.
All right. We've been hearing a lot about staffing shortages, healthcare staffing shortages. We've been hearing about shortages in almost every field, but I'll tell you, it's hard to think about something more important than healthcare shortages. What are the contributing factors in this issue?
Sure. And the first, the most obvious is COVID itself. Since we are treating patients who have COVID, we've had plenty of our own staff members and our own physicians contract COVID and be out for at least a couple of weeks before they test negative and can return back to work. So that in and of itself has created a shortage of healthcare workers. Combine that with the surge that we had last month, as well as the fact that all of us baby boomers, I'm right at the end of the baby boomers, so all those baby boomers are needing more and more healthcare. So supply and demand, there are more people needing healthcare and less healthcare workers right now because of shortages, because of COVID. So put that together and we have the perfect storm. Yeah,
that's certainly understandable. And I guess there's when you get older, the illnesses fall into a kind of a pattern, a range, if you will, as opposed to younger people.
They do. And you know, when we have older patients, certainly it creates more issues, more time that needs to be spent with them, of course, to get a comprehensive healthcare plan. So that in and of itself takes more time, and which, you know, less time and longer waits for patients, by the way. So, you know, one thing that we're asking patients is please be patient with us, no pun intended. You know, we have, you know, we have less healthcare workers and we have more people needing healthcare. So you may have a little bit longer wait for your appointment. If you have something urgent, we get you right in. But you know, be patient with your docs.
Yeah, I was going to say the weight factor could be significant, and obviously, if you have something that needs immediate attention, you can go to an emergency room, but that's not the same thing as needing surgery.
Sure. No, it's not. So the good news is that we have wonderful nurses that work with us who will triage phone calls and appointments. And if someone truly needs urgent care to be seen the same day or the next, we get them in. We don't book them, we get them in, and we do what needs to be done. So for sure.
All right, big question. How about Doctor's Day?
Doctor's Day, absolutely. Thank you for that. That's, Doctor's Day, the Medical Society is recognizing doctors on March 30th, which is Doctor's Day. And this year, I need to be a champion for my docs because we have 29,000 practicing docs in Pennsylvania at the House of Medicine. And, with COVID the last 2 years, no one expected or invited a virus to wreak havoc with our patients and with our doctors, but it did. And the true measure of us as a medical society, as the docs in the House of Medicine in Pennsylvania, is how we rise to meet that challenge. And I think our docs have performed brilliantly. It's a time for docs to be heroes, and I think we've got them. I've seen examples, Terry. I've seen older docs in retirement, 80-year-old docs coming out of retirement to volunteer to go into vaccination tents and put shots in arms. And I saw a picture of one of them at the end of his 8-hour shifts, still in the vaccination tent, sitting on a fold-up chair with his legs up on another fold-up chair, mask still on, of course, exhausted. But you looked at his eyes, and he had the biggest smiling eyes you could ever see because he knew he was doing the good. I've seen hospitalists, intensivists intubating patients on a ventilator before they could get their COVID vaccine, before the doctor could get their COVID vaccine. And being there at the mouth of the volcano, putting a tube in a patient who had COVID and not skipping a beat. The thing is about docs is none of these docs would call themselves heroes, but I sure will. As their president of the Medical Society, I will call them heroes for the rest of my year as president. So especially this year, Doctor's Day on March 30th, I would ask the public to please recognize your doctors and the fantastic job they are doing. We do have a link for the Medical Society for patients to nominate their doctors for recognition. It's a very simple form to fill out, and I think you guys have the link too. It's pamedsoc.org.
Right, it's up on our screen.
Terrific. And I would really ask patients to recognize your doctors.
Okay.
I'm in my 34th year of practice, and when I have a patient simply say to me, "I appreciate what you're doing. You really made my day, doc. You really helped me." It never gets old.
Yeah,
and
that's great.
Need to hear that.
That's great. All right, we're going to run to a break, and we come back. Let's talk about what types of resources exist for healthcare workers experiencing burnout.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
All right, we're talking about burnout for a whole variety of healthcare workers. Well, burnout exists. What resources are available to assist healthcare workers?
Sure. So burnout's a real thing. And even before the pandemic, doctors, nurses have been faced with so much paperwork, prior authorization that what I've seen in my 34 years of practice is that doctors and nurses have become a little bit less collaborative and more insular because they have so many things to do in a day. They're kind of in the zone and keeping to themselves, getting their stuff done, and that in and of itself causes burnout. There are resources, though. There are resources to help. One of the things that I'm passionate about in my years as president of the Pennsylvania Medical Society is a program called servant leadership. And the concept there, which was championed by the Cleveland Clinic 10, 15 years ago, is that doctors not only serve their patients and put patients first, which we've said in the Medical Society, patients first always, as long as I can remember, but we put our staff first. We as leaders are servants and not bosses. We take our nurses, our secretarial staff, et cetera, and put them first and see what they need to do to succeed. And the funny thing is as busy as we are and as burned out as we may be, what we find is that putting patients first, putting our staff first, not only do they succeed, but it actually lets burnout lift from the physician and actually makes medicine fun again. And that's a huge thing. There are doctors walking around, and patients will see people looking at this program saying, "My doc looks like he's sucking on a lemon." And some of them are, they're grumpy, and they weren't born wanting to do this. They didn't start their career wanting to do this. They're having burnout. And what we're finding is that as we roll this servant leadership out, docs are actually having medicine become fun again. They're smiling, they're interacting with their staff and their patients, and it's working. It's especially challenging during the pandemic, but there's hope. There's hope for burnout.
All right. What can the public do to help? That's how we promoted your appearance here. Let's get to it.
Yes, sir. So the first thing the public can do to help is get vaccinated. We have docs and nurses in the hospitals being overwhelmed with people being hospitalized with COVID deaths. I mean, 2 million cases in Pennsylvania since the pandemic started, 38,000 deaths. What we're finding is that when people get vaccinated, they can still get COVID, but it's more of a mild disease. They don't get hospitalized. They certainly don't die. So please get vaccinated. That's job one. I'd ask our folks. Number two, as we talked about before, be a little bit patient with your doc's offices because we are in a pandemic and we do have a shortage of healthcare workers, and it may take you a little bit longer to be seen. If you need to be seen soon, we triage, we get you right in. No worries there. But lastly, as we talked a little about before about Doctor's Day, don't be afraid to give your doc a thank you. Go to the Doctor's Day website at PA Med. Go ahead and nominate your doc. Give them a shot. No pun intended in this COVID pandemic. Give them a shot in the arm. They need to hear from you. They need. If you think you can do nothing as a patient, that's not true. All you need to do is tell your doc thank you, that you appreciate what they're doing, and it goes a long way to helping us, to lifting burnout and making medicine fun. I enjoy my patients now more than I have even when I started doing this 34 years ago. Tell your doc thanks.
I would think you would agree that applies to the staff too and the physician assistants. I mean, when I go to see my doctors, I try to be as courteous and kind, knowing that they play an extremely important role in healthcare.
They absolutely do. And this isn't just about the doctors. This is about, like you said, the staff, the nursing staff, the secretarial staff. They need to hear the thank you too, because they're facing burnout as well. They're in the middle of a pandemic as well, and they're trying to deliver the absolute best healthcare that they can. So absolutely, put them first and foremost, even above your doctors. Everyone needs to hear a thank you.
Yeah, no, and I'll tell you, the shortage applies there. Well, listen, I want to thank you for coming on, and I have an assignment for you, and that is to come back and keep us updated. All right. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.